Hi there, my name is Vic Veer. I'm an ENT consultant surgeon working for the NHS in central London. And this video is all about tonsil stones. And another word for these is tonsilleth, but I'm not very good at saying that, so I'm going to stick to tonsil stones. So let's get started, and I'll tell you firstly what tonsil stones actually are. Tonsil stones develop in a small pit inside your tonsils, and typically you need slightly infected tonsils or chronically infected tonsils that slowly makes this white stuff or pus. So that pus inside that pit becomes slowly harder and becomes a stone which starts irritating your tonsils because it's infected and smelly, and eventually you can pick it out. A lot of people worry about tonsil stones because it causes bad breath, and also it irritates the back of your throat because it's like a chronic infection and can lead to a chronic sore throat. So now that we know what tonsil stones are, let's try and work out how to treat them. So I'm going to start off with just self-cleaning and picking them out from time to time. A lot of people who first get tonsil stones end up trying to clean them out with saltwater gargles or antiseptic gargles such as chlorhexidine. This is actually the pink cleaning material we use to clean our hands just before an operation. And lastly, some people end up picking out the tonsil stones with the end of their finger or some other instrument you can buy from Amazon. Now, although none of these options actually cure tonsil stones, they do often make you feel better, thereby increasing your quality of life for a short time. There is a problem, however, of when you try and pick out the stones, you may cause a tonsil bleed, which is sometimes so severe you need to go to hospital to get it stopped, either by an operation or cautery in the clinic. Now, I said before that tonsil stones are caused by a chronic infection within the tonsils, so maybe antibiotics might be useful. Let's see what the medical research says. I did find some papers that said that when you took antibiotics for a long period of time, the bad breath that is associated with tonsil stones seems to improve, but as soon as you stop the antibiotics, the bad breath just returns again. Now, there are a few studies out there that describe different techniques to get rid of tonsil stones without removing the tonsils. And the first one I'll talk about is a laser technique, which is used to vaporize the top of the tonsils and effectively flatten out those pits so you just have a smooth tonsil afterwards. In terms of laser tonsillectomy, there are two papers I want to talk about. The first is a Brazilian paper from 2006, where they looked at 38 patients and actually measured how bad their breath was before the operation, then after limited laser ablation to the tonsil crypt. The bad breath machine, or halometer, found that using this technique reduced your bad breath by approximately 30%. The second paper is a much larger paper of 500 cases in New York. Now, unfortunately, the authors weren't particularly clear about their outcomes, but it seems that 20% of people needed a second laser operation or a complete removal of the tonsils, but overall there was a high patient satisfaction rate for a procedure that didn't require a general anaesthetic. Now, using a slightly different method, radiofrequency ablation has also been used on the tonsils to try and remove tonsil stones or cure them. Now, if you've watched this channel a few times, you'll know that I absolutely love radiofrequency ablation for many things, but I'm not entirely sure it's perfect for tonsil stones. I do understand the concept. What you're trying to do is ablate the area around the tonsil stones or the fissures and get it all to scar down and flatten out that way. But let's see what the research says. So I found a few papers related to this, and it seems, depending on your definition of what a successful outcome is, radiofrequency ablation has about a 75 to 90% chance of improving your symptoms. They didn't use a halometer or that bad breath machine to work out how bad your breath was. Instead, they use a much more gross technique, which is called a Finkelstein technique. This is when you use a gloved finger, press on the tonsil, and then sniff your finger afterwards. So it does seem that radiofrequency ablation does work for this. But if it does, why not use something like silver nitrate sticks or something even milder to try and ablate these fissures and avoid these tonsil stones from regrowing again? I guess we won't know until someone does a study about it. Now, the last option is to remove the tonsils in its entirety. If you've got no tonsils, you can't have tonsil stones. I looked at the literature for this, and there is a systematic review on the subject, and it seems if you compare a tonsillectomy or a complete removal of tonsils to all the partial removal of tonsils such as laser or radiofrequency ablation, initially of course there are worse problems in terms of complications and risks with a complete removal of the tonsil, but if you look at these patients 1 year later, only 3% of them had ongoing problems with their throat, whereas if you compare that to those patients who had a partial tonsil operation such as laser or radiofrequency ablation, you find that they have an almost 30% chance of having ongoing problems with their tonsils. So I hope all of that was useful for you so you can understand how to fix your tonsil stones. And remember, if you do want to see a tonsil stone during an operation, I've left a link somewhere here. But for the meantime, thank you very much for watching. Bye-bye.